It is just a huge honor for me today to be podcast interviewing Diana Batoon, who we've had write articles on Dental Town. I called her. She did not call me. I really loved your article on Dental Town.
Thanks.
Dr. Diana Batoon is the founder and president of Arizona Center for Breathing and Sleep Wellness and Bonita Dental in Scottsdale, Arizona. She is a 1996 graduate from Tufts University Dental School and is an active member of the ADA, AGD, AADSM, and AACFP. Her combined passion and expertise calls for a change in the way we do dentistry today to help elevate children and adults for potential sleep issues. She is an international speaker and is actively involved with Spear Education and CEREC doctors, and it's an honor that you came by the house today. I got to tell you, you graduated in 96.
Yes.
I graduated in 87. No one, I never heard sleep apnea one time.
Right.
I didn't hear it one time after a decade, but now you just keep hearing more and more and more and more, and so much of it, I would think that I would know a lot about it now. But I'm continually amazed. Like, I was at a friend's house today, and their little bitty, I don't know, 5-year-old little boy was laying on the couch, and he was grinding his teeth like it was and I'm like, I've never even heard an adult do that.
Right.
And now you're kind of at the next frontier. Like, you know, everybody, when it first came out, everybody's saying, maybe it's I'm self-absorbed since I'm an old fat old grandma. They're always talking about how the fat neck and all these things. And they say, well, he's fat and his neck's fat. And I wasn't even thinking of the 5-year-old.
Right.
But that's where you come in.
Yeah, because I think, you know, that's what we're used to. We're used to seeing our grandfather sit on a lazy boy chair snoring loud and saying, hey, they're snoring, they might have sleep apnea. But in today's society, we see a lot of children that may not be breathing right, and when they're mouth breathing during the day, they probably are mouth breathing during the nighttime, and that can cause some serious issues, and that can affect their REM sleep cycle at night. So it's a concern, I think, that parents need to start looking at, and then as dental providers or people in the dental community, if we can help identify that, we're really going to set up that kid for growing and developing a whole lot better.
Well, you know, they say in business, I went to ASU and got my MBA at ASU. That was really fun. And they would always preach that, you know, when you have all these different departments and they're all in the same computer system, it seems like the department never figures out their own problems. It's always another department. It's like it'd be someone in marketing saying, what are they doing in engineering? Or it'd be someone in engineering saying, what's wrong with the marketing department or this? And I've been totally blown away this last year where the anthropologists are talking amongst themselves saying, dude, we got hominid fossils going back millions of years. This whole malocclusion thing just popped up. And then I think of our poor country, America, 324 million people, and we got 10,800 orthodontic factory that we just churn all of our kids through for something that didn't even exist a couple hundred years ago, and that's got to hurt your brain.
Yeah. You know, I think our Western society, I mean, there are a lot of factors, our diet, our environment, certainly allergies, all those things affect a child. And so what I think it's important to note is that a lot of these kids, especially if they were bottle fed instead of breastfed, their ability to keep their tongue in the right position. You know, most people don't know that nasal breathing really is a key to healthy life. And if your tongue is positioned at the roof of your mouth, number one, it's going to help form the palate. Number two, it's going to keep in the right place so that the child's breathing through their nose. And number three, it'll help with their speech. It's exercising the tongue muscles the way it should be intended to be used. So, and it's also going to provide enough room for all the permanent teeth. So sometimes kids will have a habit like thumb sucking, biting on their shirts. You know, some of the kids that...
Biting on their shirt?
Yeah, chewing on their shirts, biting on pencils. They might have sensory issues. They might be very anxious. They can't sit still in school. So those types of behavior issues may lend to, why are they anxious? You know, and so the other question is, are we putting them on medication to keep them to function during the day? Or are we not addressing the root cause? Why is their body so noisy? Why can they not sit still in a chair during school hours? Or why do they feel tired during the day? Why are they drowsy all the time? Probably because they've got some type of restless sleep pattern during the nighttime. And for that child to experience that night after night, that could be it could be affecting their brain development, as far as memory, computating, adding, subtracting, reading, hand-eye coordination in sports. So those types of things are really affected by poor sleep.
It's really a, everybody always says, America is the greatest country in the world. Everybody that always says that, you can always be guaranteed of one thing. They've never been to another country ever. I mean, if you think this is the greatest country in the world, you obviously you probably don't even have a passport. But my friends in China and Cambodia and Vietnam and the Netherlands, in America, even on Dental Town, dentists in America are offended because, and do a search for breastfeeding on Dental Town, and some ladies out there breastfeeding in the waiting room, and the same idiot would probably go to a Rambo movie where you have some not natural man-made AK-47 and shoot 100 people, and that doesn't bother them at all.
Right.
And this breastfeeding thing is a huge component of it, and the mothers feel embarrassed to walk around. We're mammals. We give live birth to young, and we feed them. And if you have a problem with any three of those, you're an alien. And it's just, Scandinavia, Asia has the least problem with it.
Right.
You could literally breastfeed anywhere in Asia, and then people just say, yeah, it's a mammal.
Right.
She gave birth to a live young, and she's feeding it. And so in America, because a lot of that, the first time the kid starts doesn't seem to be going well, they whip it off and give it a thirst buster. So now the kid's not developing forces. He should be fighting on that thing for at least a year or two. And then when it goes to the food, they're feeding it mush. When I'm sure for the last 2 million years, you probably found some, mastodon bone and said, here, chew on that for an hour, and if you don't find anything on it, you'll be dead.
Yeah.
So the diet and the society consequence. Saudi Arabia just legalized women to drive. And America thinks, well, that's shocking. It's like, America, you still haven't even allowed women to feed their own live young outside of a closet. It's crazy. Just very, very crazy. So, when you got out in '96, were they even talking about any of this back then?
No.
How many years ago was that? 22?
Gosh, over 20 years.
So what made this all come? Where did all this come out of?
Well, I think part of it is adult sleep apnea, such a billion-dollar industry, and that receives a lot of attention. But at that point, as an adult, you're managing the sleep apnea. It's when we look at children, we have the power and the capability to correct and prevent that risk for that child ever getting to have sleep apnea as an adult. So I think that's why, people are starting to pay attention to it, because it does make sense. If you look at adults with sleep apnea, they had breathing or airway issues as a child, and I think when we can kind of help those children now, we're going to set them up for better success. We're going to set them up for, reduced risk of crowded teeth. We're going to help them breathe right during the day. We're going to help them function better at school. It's something I think that needs to be looked at seriously. But as dental providers, because we have the ability to see them twice a year, they come in for a checkup. Who knows? For when kids go to the doctor, they're going them when they're sick, and they're treating them for that ear infection. But how about that kid that gets that multiple ear infection, gets multiple recurrent strep? What's the reason why they're getting those conditions so often? Do they mouth breathe predominantly is probably a question I would ask the provider. But I think this is something that we can address and really make a profound difference, because, the kids are our future, right? We need to help them to be more successful some way. And I think as dental providers, or even as a hygienist, if you catch that on and you see that they can't keep their tongue still and they keep on thrusting their tongue forward while you're trying to clean their teeth, there's something that needs to be looked at, like a tongue tie,
Now that is that's funny that you said tongue tie, because I'm going back to this. Well, to me, it's kind of, when I got here in '87, 30 years ago, the first thing I noticed is it didn't have water fluoridation. And so I blocked off every Friday for over a year, and met with Jack Dillenberg, who was a dean of a dental school, and we set up to Arizona, and I thought, I don't want to sit here and drill, fill, and bill Monday through Friday for 60 years and not make a pile in the dent. I mean, it seemed like the obvious low-hanging fruit is water fluoridation. And I am embarrassed on behalf of orthodontists that the only people talking about this is anthropologists. So it's like, what's the deal? Is it just you're afraid this is going to hurt your gazillion-dollar business? And so back to the breastfeeding. I mean, I'm glad that all my daughter-in-laws, when they gave birth to live young, that actually some lady walked in there and gave them an hour deal on breastfeeding. And but now, because of that, there's a huge surge of people saying, I think your baby's tongue-tied.
Right.
And so the ones that send to me, I'm sending them to pediatric dentists, or it's like I'm all of a sudden I'm not an expert on some 6-month-old, whether it can nurse or not. So what do you think of that?
Well,
did you buy yourself a laser?
I did, and for a long time I had a diode. And I just recently got a gas laser, and it's a world of difference. I mean, we're talking from 15 to 20 minutes with a diode to 5 seconds with a gas laser.
So was the gas carbon dioxide or
yes,
carbon?
Yes.
Which one?
Light Scalpel.
Light Scalpel. And who makes Light Scalpel?
I think that's the company, Light Scalpel.
Or
Lux. Is it called Lux?
Lightscalpel.com. I would say.
Something like so. You got a Light Scalpel carbon dioxide laser.
Yes, gas laser.
Gas laser. Everybody thinks I have a gas laser, but that gas is natural. And so you got a carbon dioxide gas laser, and you used to have a diode. You said the diode would take
15 to 20 minutes.
15 to 20.
And for a child, they can't sit still in your chair for 15, 20 minutes while you're holding their tongue. This 5-second procedure really makes a big difference. And we actually get...
And what are you actually sizing?
What do you mean?
I mean, is that under their tongue?
So it depends.
It depends.
Yeah, so I go through a protocol to check range of motion. Usually a parent will come in and tell me they've got some speech issues, or they're working with a speech therapist, or they're predominantly mouth breathing. And so I'll usually check that. So what we learned in dental school, tongue tie, is we're looking for the heart-shaped tongue when they raise it to the roof of their mouth. There are a lot of kids out there that have a short frenum, or they have a tongue restraint. Like if you touch it, it feels like a guitar string, right? If they can't reach it to the roof of their palate more than 50%, most likely they're not nasal breathing at night. So that's something that needs to be addressed. The question is, when you see that, do they have a retrognathic mandible? What does their profile look like? Do they have a rolled lower lip? Like, what are some of the things as dentists we know and that we're comfortable with looking at? Could this be a cause? Do they have crowded lower teeth? Or how about the adults that had braces and they have relapse right there on the lower anterior teeth? So those types of things we really look at.
So do you recommend that laser?
I do.
Would you still buy it again today?
I would.
You remember how much it was?
It's around 30 to 35,000.
So did you just buy it, or did you do like payments for 5 years?
Well, there are different programs. I did mine like a financing, but whatever.
Do you remember what the payment was?
I think it was
per month.
It might have been like around $600.
And the reason I ask kids is because a lot of times you'll look at a number on a balance sheet, what the asset, the equal sign balance with the liability you owe, the equity you have in it, and you'll say, well, this machine's $30,000. And I'm like, well, that doesn't mean anything. If you finance that and it was $600 a month, so you already have an asset. Say you have an asset that does $1 a day. And someone says, I'll put this asset in there. It doesn't matter if it's 10, 20, 30,000, but the payment's $600 a month. The question is, could you do you'd have to do $600 a month of billable procedures to break even.
Right.
So what procedures are you doing that got to, I mean, did you do more than the payments? Was it cash flow positive?
Yes. So what we did was we did like a laser day. So I usually book it in the morning and they'll have 4 or 5 patients. It's code for lingual frenectomy. It's D7960. Some of that could be billed through medical. So that's something that you should look into as well.
D7960?
Frenectomy or frenulectomy.
Okay, frenulectomy.
Yeah.
Okay.
But a lot of dental insurances will cover that procedure code. It might be subject to their deductible. But what's great about that is you'll start to notice if a child maybe could not, had a reverse swallow or could not nasal breathe because they couldn't reach their tongue up to the roof of their mouth, you'll start to see some of that improve. Maybe they were working with a speech therapist and they couldn't do certain functions. You'll see that improve right away. I've had a speech therapist call me and go, hey, I've been trying to get her to do that exercise for months. What did you do? I go, I did a frenectomy. Because in that, in that field, they don't have access to a laser, right?
Right.
But I do recommend the gas laser over dye because it dissipates less heat too,
So now your practice is in Scottsdale.
Yes.
And that's where all the rich people live. And I'm down here where all the poor people live in Phoenix. Just want to clear that out.
Or there's rich people with debt. So.
Rich people, yeah, they make it till you, or fake it till you make it.
Yeah, exactly.
But first of all, what type of practice do you? I mean, is it a family practice?
It's a general practice, but I treat a lot of children. We're a sleep and TMD practice, so.
But what percent? But what percent of your practice would you say is sleep and TMD?
No, right now, it's probably about 35%. It's getting,
That's
higher.
a huge niche.
Yeah, it is.
Because that is a niche.
Yes.
I mean, kudos to you. I mean, to be up there in very competitive Scottsdale.
Yes.
And to have a family practice that focuses on kids with sleep and TMD.
Here's the thing. Moms talk. So if you do
5 to 1 over men, right? No, that's what.
That's true.
I mean, I don't want to interrupt you, but I mean, there's things that you have to realize, like 80% of the people on YouTube are men. 80% on Tumblr are women. Whether you're talking about any of the apes or monkeys, every time a boy, monkey, ape says something, the girl said 5 words or sounds. So they're talkers. And they're very social.
Right.
A boy would rather stare at YouTube.
Yeah, and watch.
And watch something for 15 minutes. He don't want to get on Facebook and interact.
Right.
Say, hey, and he doesn't want to interact. He wants one-way conversation. And I bet you so many times, I mean, I had 4 boys, you had 3 boys, right?
Right.
How many times did your boys come home and you wanted to talk to them about their day and they just wanted to go in their room and shut the door?
Yeah.
I mean, what percent?
Very high percent.
Yeah. So you're saying that moms are talkers,
right?
And focusing on kids was a big practice builder,
right? And I think because they're nurturers, if they had a good experience or they were struggling with something like that, say they went to their doctor, they went to a chiropractor, they went here, and here, and nothing was working for them, and they come to me, and we look at their airway and we improve their sleep, and all those other things get better. They are definitely going to share that with their neighbors, with their family. On social media, at school. And I think that's what started it. Parents started talking. The other thing, too, is it might seem too radical for some families. Why didn't my orthodontist tell me about that? How come I didn't hear about this from my dentist before? And that's the thing. We didn't know about it back then. And I think there is room for dentists to be educated about pediatric airway now more than ever. It's just we have to be open to that idea, just like when oral cancer.
I bet what you really say is, he probably practiced in Phoenix, didn't he? That's what they all say in Scottsdale. Trust me.
No, but I think it's really important to kind of look at that. Just give a benefit of the doubt. We didn't know about what we know now. They're all connected. That idea of integrative dentistry is really at the forefront of our profession now. Well,
it's funny you say that because today the big buzzword is the oral systemic link. So that's the dentists all think that's a big buzzword. But my friends who do kidneys, that's their big buzzword. That for years they just stared at a kidney and now they're realizing all these other things are connected. So every specialist I know, that's their big thing now. Like, I spent my whole life in a colon, and now I realize it's connected to the A-bone and the funny bone and the head and the teeth. And, you know what I mean?
Yeah.
So that's everybody's eureka in healthcare now.
Yeah.
Is how much they're not...
But I think as dentists, we're so focused on, oh, there's a cavity, let me drill and fill it. Okay, we're done. But I think if you see other signs, you know, of grinding, you know, why is this 5-year-old, look at the teeth, what's happening? You know, are they stressed? No, kids that are 5 are not stressed. They're not sleeping well. So that's like their body's way to deal with, I need airway. So they're moving their jaw around left and right, you know.
And this one kid that we're talking, I know it's acidotal and it's crazy and I shouldn't say it, but he's so small, he looks like he's a dwarf. And I'm looking, and then the mom's sitting there saying, well, he's shorter than his cousins who are 3 and 4.
Right.
And I'm looking at this kid on the deal, and you know, I've read papers before. Do you think not breathing at all can make you not optimally develop height?
Exactly.
Do you believe
that?
It
affects the growth hormone. Yes, I absolutely believe that. I mean, my background in undergrad was microbiology. There's so many hormones that come into play that work with our system and our organs. When you don't have enough growth hormone secreted at night, every night over a period of time, it's going to affect something. So I'm a strong proponent for believing that, growth hormone may be effective.
So you're saying you should just have Lance Armstrong pedal his bike over your house every night and give you a shot?
No, I think we should look at why is that child shorter than he should be. His dad's pretty tall or his mom's pretty tall. Genetically, should be a little bit taller at that age. So I do feel like there's a link, a strong link.
So what's the other 2/3 of your practice? If 1/3 of it is children and sleep and TMD?
It's regular dentistry.
So the rest would just be like what?
I'm a really big advocate for CEREC. I love CAD/CAM dentistry. I restore my own implant crowns, screw retained, custom abutments. I think that kind of technology, I think as a dentist, especially if you're a young dentist starting out, I wish that I had done all those education forums earlier. I mean, back in my day, I did Pack Live and...
Pack Live with Hornberg?
Yeah. Do you remember that?
I went.
I'm dating myself.
Yeah, big Dave Hornberg fan. Love that guy.
Yeah.
I took LVI when it was just
Larry
Rosenthal and Bill Dickerson and David Hornberg.
Yeah. So I think as dentists, if you kind of keep at the forefront of the technology, what's out there, you really, like we use oral ID, detection for oral cancer. Visalite was one we used in the past too. So there are different types of things that can separate you from other dental practices. And so people love it when you're a one-stop shop, so to speak, right? When they can get all their services for themselves and their family, and you could take care of them right then and there. I think if you offer them that is what's going to separate you from another dental office.
When I got out of school 30 years ago, it was all amalgams and gold crowns, and the cosmetic dentistry was a PFM. And then we went through the materials revolution.
Right.
Like Denmat and these early companies, Ultradent, 3M, which then enabled the next cosmetic revolution. And then we're in the backyard of Intel, and then next was the digital revolution. And what's funny about CEREC, which started in France, and then they gave up and it went to America. The problem was they had to wait till the processor got bigger and bigger. I mean, when they knew everything they wanted to do, they were working with an Intel 286, and then the 386. I had a CEREC 1.
So did I.
And that tall, handsome man in Scottsdale, Samir Puri, who's the world-renowned expert on all that. I don't even know if he was in grammar school and I had a CEREC 1, but the problem wasn't CEREC, it was the processing speed. Yeah. And the processing speed really didn't get great enough until like CEREC 3, you know what I mean?
Right.
And all that. And so that's that whole digital revolution, film, the digital x-rays. Then I'd say it was the implant and sleep.
Yeah.
And so I was wondering, do you place implants?
I don't place them, I restore them.
Yeah.
Yeah.
But tell the kid right there. So we're in our backyard. You live in Mesa.
Yes.
Which has a dental school that graduates how many a year? I think it's 170.
Wow.
Or no, Midwestern I think is 170.
Yeah, Midwestern is larger.
Yeah, try to find AT still Midwestern, because when I go lecture in those schools, those kids tell me I'm going to come out of school $350,000 in debt, unless they're Mormon, and then it's like I'm already married, have a kid, and it's $400,000 in debt.
Yeah.
And then so they're looking at the CEREC machine, which is a big chunk of change.
It is.
So what would you tell a kid who said, "I'm worried about debt. I got $400,000 in debt."
Yeah.
And you're telling me to buy a machine that costs how much? $150?
Yeah, $150.
So what would you tell them?
I would tell them to meet with your accountant, have a business plan, and see if it makes sense to do it now or wait till later. But that's where I think sleep and TMD is something that doesn't have a lot of high overhead. It's just like a lab bill. And to investigate some of those services that, as a young dentist, you could start doing. Technology is expensive, but it's an investment. It's an investment in allowing you to do your workflow better, to do what you do daily better. So if you are that type of dentist that you can do CEREC crowns, you like that kind of technology, I would say go for it. Because that's why I bought a laser. I figured out what I needed to do, what the payment was, so that I can incorporate it with the practice.
Midwestern class size in Glendale, Arizona is 141, and AT still is 76.
A lot of dentists.
So Ryan, can you add those two numbers together? That would be 217. So the deal, and I believe you're in the most competitive area.
Oh yeah, I am.
So what would you tell a kid that was coming from Midwestern or ATCO? 217 kids say, I'm going to go to North Scottsdale. That's the greatest place to go.
I would tell them to think twice, to think 3 times, to think 4 times about it, because I think there are other areas in Arizona that they could benefit from.
And where do you think those are?
There's some pockets, I think, where the growth is. I mean, it looks like Chandler's a growing area. Am I right? I think Gilbert's saturated already.
How rock bottom would you have to go to live in Chandler? I mean, wouldn't you just move under a bridge and live in a box first?
No.
Well, the big boogeyman in dentistry that everybody hates is Pew Research, which I love Pew Research because dentistry is not even a fraction of what they do. Mm-hmm. Most of it's environmental stuff in the ocean.
Right.
Fish, size of tuna.
Right.
I love Pew. But Pew does the research for every state because they're a big proponent of dental therapists.
Right.
Just like physicians.
And that's a big topic now, right?
Oh, it's huge. Well, it's actually 2 issues. I want to talk about one first. One is a physical or dental therapist.
Right.
That's a whole other issue. But the issue I like is that they've done the demographics of every single state. Like you can go to Pew Research, go to Arizona, and you can see every county from dentists per 1,000, cities with none.
Right.
And so you're in AT still. When I got out of school 30 years ago, you know how hard it was to do demographics?
I know.
If I just told someone, what is the number of dentists per patients in San Diego? God, you'd have to go sit in the city library for a week.
Yeah.
You'd be opening up yellow pages.
Yeah.
And
now there are no yellow pages. They're online.
And now you have Pew Research has cranked this stuff out. And it's just, I know kids. And what's really interesting with student loans is the highest default rate is with the lowest amount of loan.
Oh, I believe it.
And by the time you're over $100,000 in student loan debt, the default rate's almost none.
Yeah.
And so who's the only person watching demographics? The people over 400 to 500. Mm-hmm. So they're in so damn much debt. They're like, okay, I already got an F in student loan debt. I better get an A in demographics. Right. And they're usually the ones in school who got married, had kids, for whatever reason, they already blew $500,000 before they got out.
Yeah.
So they'll find these cities with no dentists, with 6,000 people in the county,
and they'll
set
be
their
busy.
own fees, take no Medicaid, no nothing, charging fees higher than you are in Hootie Tootie Scottsdale, with no insurance, cash at the door, and they'll the first year they'll do $1 million and take home $400,000.
Yeah. And that would be my advice: is they'd really have to research the demographic data.
So now, okay, go ahead.
Yeah, so I think that's really important too when especially if you're thinking about opening your own practice. Unless you were going in with somebody who was phasing out, that would be a different story. The patient base is already there. But yeah, I wish I had that resource when I got out.
And you know how you make the older dentists phase out faster?
How?
You start crushing glass with a roller and making meatloaf and bring it in hot. Say, I made you lunch today last night. I stayed up and made you this meatloaf, potatoes. The dental therapist side. So Pew says, okay, this happened to me a lot. You know, I raised 4 boys. You don't want to go to the emergency room, so you go to Walgreens because they fell down, they broke something, you know, whatever. And you go in there, they don't have an MD. And it's not a registered nurse. It's halfway in the middle. It's a
like
PA. It's a PA.
Mm-hmm.
And they're saying, so dentistry needs that. What are your thoughts on that?
You know, I've kind of listened to both sides of that, and as a clinician, I can see where the concern is. But on the other end of the spectrum, that there's a need, and how many people would go out there and serve those people and jump to do that is really scarce too. So I think that there's a happy medium where we can meet in the middle. But if there's a need and Arizona can afford to have those therapists, as long as it's regulated in the right, proper way, I don't see a problem with it. But I don't know where they are as far as setting those regulations and what, you know, certain procedures, how are we going to regulate that? I know they've done them in other states and some have been successful with it and some have not. What's your opinion on that?
Well, my townies in other states, you know, it's kind of the same radio over, like, you know, you go back to Bob Barker days in the 70s. Everybody thought hygienists was going to ruin the profession, you know, and as soon as they got him, they realized they never wanted to do a cleaning again. Let her do them. So my buddies in the States of Dental Therapists, they go, oh my God, I'm hiring these and I'm never doing my fillings again. Mm-hmm. So now they got the hygienists doing their cleaning, the dental therapists doing their fillings, and they're just concentrating on everything else. So they all love them. Now, what did Pew want? They thought, well, if we get all these these dental therapists, they'll go into the far reaches of the woods.
And they didn't.
And they didn't, and that's because the deans, all except for ours, A.T. Still, Jack Dillenberg pioneered it. He's the only one who did, and everybody in this state threw him under a bus and said he was a hippie. He was a New York hippie. It's like, dude, hippies are from Berkeley. You didn't get the coast right. You know what I mean?
Yeah.
But he said the problem with all the dental schools is they pick all these people in with the highest grades in calculus and physics and math. And where do they go? Wherever they came from. Mm-hmm. And he said if you want people to go to rural, then just accept kids from the rural.
Right.
But all the dental schools won't, because the little farm town girl might have only had a 3.2. So they'll take the 4.0 chick who grew up in downtown Scottsdale.
Yeah.
And the most, and I'll say one final answer, and this case closed. All the white deans of all the white dental schools couldn't believe nobody would go to the Indian reservations. And Jack said, I got an idea. Why don't you just accept a bunch of kids from the Indian reservation? Yeah. Well, the kids from the Indian reservation might not have got in to the dental schools. But guess what? The Navajo Indian Reservation is loving that every year that Jack was dean. I mean, we have, 18? I mean, how many reservations are in the United States? Like,
gosh,
220?
A lot.
Or something like that. And Jack was out there saying, and they're still doing it because they want to make the top rank, you know, UAP has a higher freshman class grade point average than USC. Mm-hmm. And that elitist means little kids get no dental care in rural areas, poor areas, Indian reservations. Right. And Jack was the one, and everybody said he was full of crap, that all of his kids would just come into Phoenix. Well, if you're from the Navajo Indian Reservation,
they want to make that drive.
Where do you think you want to live?
Right there. In their Navajo reservation.
In their Navajo, I mean, my God.
Yeah.
I mean, Jack was such a pioneer, and it was really tough
for him he
to
retired.
Watch him get thrown under a bus and beat up so many times so bad. But it's true. So if Pew wants to spend any money, they should be giving debt forgiveness to kids who go to these places. But that kid going to that place isn't going to be happy, because where's he going to be happy? Wherever his live birth mammal mother gave birth to him.
Yeah. So there's a dilemma. Yeah, there's a problem there. How are those people going to get served? I don't know. And
what's really sad is half of America lives in 147 metros. and the other half live in 19,008 towns. Well, that means those half pays half the tax bill.
Yeah.
But all the universities are in the cities, and they only get city folks. So it's like the rural pays for half the bill, and they don't even get a third of the assets from it. I mean, if they're going to build a museum, is it going to be in rural? Yeah, so everybody in rural pays half the bills, and then all those universities just accept the people, in the urban.
Well, I know there's a growing problem with having dentists commissioned to work in the Indian reservations too. It's always
but that's even another problem, because I've gone up there a lot to the city. Do you think a Navajo who doesn't speak a word of English wants this white cracker to work on him? No.
Yeah.
I mean, they don't even relate. It's the same thing with, look at women. Do you think a woman wants to go to a male gynecologist like me?
Probably not.
Yeah.
Yeah.
Yeah. I mean, people are tribal.
Yeah.
And I couldn't imagine being in, like, say I was in Iran.
And
And I need a root canal.
Yeah.
And they said, well, everyone's Persian. They speak Farsi, but there's one Persian, and he's clear on the other side of town, but he speaks fluent English. Well, where would I want to go?
Probably,
to that guy.
Yeah.
So I don't think the Navajo don't want to have dentists that don't speak their language. But anyway, we're on so many different sides. So when you say restoring, this is out there. When you say you restore implants, at 60 months, 20% have peri-implantitis.
Yeah.
Are you doing any laser therapy? Are you using your laser on any peri-implantitis?
I do. I mean, I work closely with our periodontists, especially with the group that place the implant for us. But I have a strict hygiene.
What group's that?
AZ Perio.
With Ralph?
With Ralph and Steve and Dirk, and Holly.
I love Ralph.
Yeah.
He has over 6,000 posts on Dental Town.
Really?
Yeah.
Kudos to Ralph. But yeah, I think that when you have a good...
And he owes me. You know why?
Why?
You know who his wife is?
Yes.
She stole him from me. She was my hygienist. She worked for me.
Oh.
Ralph stole my hygienist and married her.
They have a family
Can
now.
I sue him?
No.
Okay.
Yeah, he's got a kid now.
Yeah. And so anyway, so when you get peri-implantitis, you just send it to Ralph. You don't.
Yeah,
you don't
but I
use your
think
laser.
that a lot of our implant patients, if they have like more than one implant, we try to keep them on a strict hygiene recare. So whether they come in instead of every 6, we might see them every 4, especially as they get older. There are certain things that I think you have to train your patients on the dental work that they have invested in and how to take care of it. Because for the longest time, I remember people thought, when they had a crown, the tooth's covered, I don't have to floss there. And I tell them, you have to floss even more that you have a crown. Your body recognizes it as foreign. So
let me ask you this. Your undergraduate degree was in
microbiology.
Is in what?
Microbiology.
Microbiology. The New York Times pissed off every dentist in North America when they ran that article that there was no research on floss.
Yeah.
And then the dentists had a rude awakening when they went to PubMed and found out there were 5,200 PubMeds on why you should fluoridate the water, but there were none on why you should floss. There was none. And now it seems like a lot of the most exciting breakthrough research is that when I look at you, I see 10 million cells that you got from your mom and dad.
Right.
But in your 30-foot digestive organ from your mouth to your rectum is 100 trillion cells. And NYU just got their dental school just got a $2.2 million grant tying gut microbiome to periodontal disease.
Right.
And almost everything I read, almost every time I turn around, they're like, wow. I was reading one the other day that this caused, was highly linked to type 2 diabetes. This was linked to periodontal disease.
Yes.
And then when you start reading, the most common transplant on earth is not a kidney, lung, or organ, but it's a fecal matter transplant. And I mean, that is some amazing stuff.
I didn't read that, but
yeah,
my
it is amazing. You can have twin mice, and one has a disease and one doesn't, and fecal matter transplant, and this one cures disease, and the FDA has already approved it for one disease in America.
Okay.
So and you got a heavy background on that. So I've always thought
that there was.
I've always thought, because do you agree or disagree with this? if they have a mouthful of cavities, they don't have gum disease. If they have a mouthful of gum disease, they don't have 10 cavities.
Yeah, I think that the gut biome is really linked to a lot of those things.
That
Because you could have somebody
30-foot tube is all one
Yeah,
piece.
yeah. No, I've been reading more and more about that, and I think that there's a book too. I think by Stephen Lin, The Dental Diet.
Right.
Yeah.
Right.
Have
We
you
had him
read
on the
that?
show. I
good.
did. I got it right in that room over there.
Okay.
In fact, Ryan, go get that book, Stephen Lin, The Dental Diet. We'll plug
There's
him on
a
the
little
video.
plug for you,
My
Stephen.
Australian buddy Steve Lin will plug that. He'll love you for
Yeah.
that. Did you read the book?
Not yet.
Do you have the book?
No, you're going to give it to
I'm
me.
going to autograph. I'm going to forge Steve Lin's name.
Okay.
And
no, there's some truth to that. I mean, all of that makes sense. I mean, isn't it coming full circle
and
again?
some of it where you think, oh well, they're eating
Thank
crackers. Here's the Dental Diet by Dr. Stephen Lin, who lives in Australia, where my brother gave up on America and moved to Australia, and he loves it. But when everybody's saying, oh, that candy or that sugar, brush the plaque off, it might be that the cracker and the candy and the sugar is going into the gut.
Yes.
And different bacteria that live off sugar
Right.
are very different than ones that live off, say, greens or pork, or in my case, Cheetos and Mountain Dew. So, it's very amazing.
Yeah.
What do you want Steve Lin to say to you?
Steve Lin, I want him to say,
Dear
Diana, good luck in your future.
You
much success.
Are the best dentist
What does my
on earth. I wish I could be half as good as you. Love, Stephen. Well, I didn't know if it was Steve or Stephen. Stephen Lin. And
you'll probably get an
Howard
email or text after.
And Howard too. But
Aw,
did you read my book?
Yes, I did.
Good.
Yes. So, no, I'm very excited that you and I are thinking on the same wavelength here.
And because a lot of you say you restore implants at 60 months, 20% have peri-implantitis. At 9 to 14 months, it's 40 to 60%. And I'm hearing what I see in the future is two things. A lot of people believe that it's not it's the titanium, and they're not seeing it with the zirconium implants.
Right.
But the people treating peri-implantitis are mostly doing like LANAP lasers.
Yeah.
Is Ralph using LANAP, or is he treating peri-implantitis with lasers?
I know that he does treat. I don't know what he's using.
Do you talk to him much?
I just talked to him last week. But
Tell him to come on the show and answer that question.
Okay, Ralph.
Tell him you made the pilgrimage all the way to the poor part of town. Just tell him to go to
the poor part of town,
tell him just to go down
way.
to where Mother Teresa Calcutta treated the poor, and then I'm like 2 blocks south.
No, I think that really needs to be addressed because more and more people are getting implants now, overdoing 3-unit bridges, or they're doing all on 4s instead of, the traditional dentures. So I think we really need to hone in on how to take care of those restorations.
So you wrote, the reason I called you, and you, when I called you, you said wrong number and hung up, and I had to call you back 3 more times. You wrote an amazing article on Dental Town, Sleep, Breathing in Children by Dr. Diana Batoon. Do you remember writing that?
Yes, I do.
And tell them why they should go on Dental Town. And one of the places magazine. And tell them what month and year was that?
This was February of 2018. But I think it's really important for everybody to read this, not only because Dental Town's online, but it's a great way for you to find information of something that is important to look at your pediatric patients. And we're talking about 18 and younger, taking a look at these kids in a different way. And, with the new verbiage or the statement from the ADA, their position on sleep apnea, they're holding dentists to be looking and evaluating children for sleep issues. We can't diagnose sleep apnea, but we can help evaluate for that.
Well, we're getting close, though.
Yeah, we are.
There's a lot of reasons
as a dentist, you can help identify that. So, but it's a starting point. I think if we start to screen for these children the same way we're screening for oral cancer, we're going to be way ahead of the game. We're going to be saving lives. We're going to be making a lot of change, you know, in the growth and development of children. So, yeah.
Okay. So a lot of people are, whenever, it seems like you can't listen to someone who's talking about sleep apnea that doesn't also talk about medical insurance billing.
Right.
Is that extra noise and confusion? Is that a big part? Do you bill much with medical or not really?
Okay, so if there's a medical condition, that's the hard part about medical billing. For children, they have to be really sick or have had multiple cranial surgeries, maybe a cleft palate, cleft lip. There are different services out there that can help you determine if you'll have a good chance of being able to bill for some of this. The problem is medical billing is a different beast than dental billing, you know, and you might not get reimbursed for anywhere for 4 to 6 months. It could be longer. And as dentists, we're not used to that. You know, we're used to doing a procedure, we get reimbursed within a reasonable amount of time, 2 to 4 weeks, right? It's a different beast and it's more work for your staff. So that means you have to invest in software maybe that can help. All medical billing for, you know, sleep apnea requires SOAP notes, requires documentation, proper x-rays, maybe nowadays a cone beam might be helpful if it's warranted. But there are different types of documentation that really the dentist has to provide. And if you're missing one of those pieces, your claim will get kicked back, denied, you know, and longer to get reimbursed.
So so what percent of your practice is medical billing? Would you say negligent?
Yeah, I think it's small. It's getting more and more because a lot of dental insurances don't cover TMD. A lot of dental insurance plans don't cover TMD. If it's sleep apnea and you have a diagnosis, we usually bill that through medical because it's a medical condition.
So I also noticed you lecture for Orthotain. Does that name come from ortho entertainment? Orthotainment?
No.
What is the tain in Orthotain?
Sure. Well, Orthotain is a parent company for a system called the Healthy Start. And the Healthy Start system is a functional appliance system that is comprised of different types of appliances depending on the age of the child, the arch width, whether they're like a pseudo class 3, because you can correct that if they're a pseudo class 3. And if you catch it earlier on, you'll help correct that condition and hopefully put them into a class 1 malocclusion. The other thing that it does is it helps guide permanent teeth into an ideal overbite and overjet. So it also, some of their functional appliances can actually help prevent and stop grinding that children are doing at night, or correct the thumb sucking and other habits, oral habits that they may have, you know, finger sucking or those types of things.
And how did you find these? Were they in Winnetka, Illinois?
Yep, that's in Illinois, near Chicago. And the founder actually is Dr. Earl Bergerson, who is a certified orthodontist, so board certified orthodontist. So his appliances are actually very, very well thought out. There's research behind it. I went to Tufts, and so their pediatric and ortho department there used a lot of their functional appliances.
What's the guy's name?
In Tufts?
No,
the inventor?
Orthotain?
Earl Bergerson.
So Earl, I'm sure he goes by Big Earl. Does he go by Big Earl or just Earl?
So.
Every Earl I've ever met.
Dr. B, they call him Dr. B. Yeah.
Okay, so
yeah.
So basically, then he's done an innovation. This is you feel it's different.
Yeah, because number one, their appliances are ISO certified and FDA cleared. That's really a big deal for me in my practice. I don't want my patients choking on material, right? So it's not a choking hazard if they have to go through those certifications. And it's gone through a lot of research. They have, in their appliances, and I'm sorry I didn't bring one today, but they have pads to close like an anterior open bite. there are different things that are developed into those appliances, and they help to train the tongue to be up in the right position so that we're nasal breathing. It corrects a tongue thrust for a child so that they're not thrusting their tongue forward, causing an anterior open bite. So a lot of times you might see an older child that had phase 1 and phase 2 ortho, and then they end up with an anterior open bite. It's because nobody corrected their mouth breathing, or maybe they had a tongue tie.
So you have 2 different websites. You have MomentumDentistry.com.
Yes.
And you have BonitaDental.com.
Right.
Why do you have 2 websites? What's the difference?
Well, part of me being an educator is I speak, and so my MomentumDentistry.com is my speaking website. And that's, where I talk about technology, CEREC, talk about sleep apnea in adults and children. And also I'm developing a lecture series for young dentists, 10 years and under. So,
and you're developing a lecture series?
Yeah.
Because you were on the ADA Young Speakers?
Yeah, new and emerging speakers. So hopefully, that'll be coming around the corner, and I'll help develop that to help younger dentists.
So is that course is going to be online on your website?
Well, I'm hoping to do online with you guys, and then we're developing a series. So it'll be, I work with Lois Banta, so we'll, start working on developing a series of lectures for young
And why did you pick Lois?
Because she knows her stuff.
She does. I love Lois.
She's very genuine. Hey, Lois. And she's a very great mentor. She's all about paying it forward and helping people. And I think that's how I feel, too. I think there are some people in the dental industry that really like to help our colleagues. Because I don't want people to go through, the hardships that I have. And if I could tell them something that'll help them, we need to do that in our profession. Remember, you said we're tribal.
We are. And, it's so funny because every animal is. I mean, I love watching on YouTube where you'll see like a pride of lions and some girl's pride gets trash, so she tries to join the other pride. They kill her. I mean, it's like people are tribal. It doesn't matter if you're a lion, tiger, whatever. It's crazy. Why did you go with momentum dentistry instead of angular momentum dentistry?
Well, because dentistry is ever changing, right? And you kind of have to move with the flow. You can't get stuck in thinking old ways. You have to be open. Like back when I started my practice, I didn't have to advertise on social media. It was just my patient told her neighbor. And now I think all dental practices, you have to have some type of social media presence to survive.
So now this is Dentistry Uncensored. I saved the ugly till the very end. I've always been sensitive to sexism because I grew up with 5 sisters, and we were within 100 yards of the Arkansas River, and I could fish and swim in the river, but my sisters couldn't go within 10 feet of the edge. They were paranoid if they got off the yard, but I could leave for a day. I remember when I graduated from high school in 1980, Margaret Thatcher became the first woman president, prime minister of the United Kingdom, and even the priests were saying, what the hell would they do that for? and it's like every male adult in Kansas thought, did England just flush themselves down the toilet? And then all through college, I watched her to become one of the greatest prime ministers. And when I was a little boy and I fell in love with dentistry because my next door neighbor, Kenny Anderson, was a dentist, I never saw a girl dentist in my life. So now, fast forward 30 years, every dental school is half women. Every half of Britain would rather have women, Margaret Thatcher back than the one they got now. But I still see a lot of sexism. I still see a woman dentist, and she's married to a man, and they both have a long, exhausting day, and the dad grabs a beer and watches ESPN and the lazy boy while he's snoring, and the mom's like, I still got to do all the cooking, cleaning, I got to do all this stuff like that. Where you're sitting now twice, I've had a woman bawl so hard she could barely talk because after building a practice as great as yours, her husband making $75,000 a year gets transferred to where he's going to make 80, but he gets a bigger title, and he's like, come on, honey, let's go. And she's like, and he's like, I'm going. So she looks at her little boys, and says, do I blow up the family because this freaking Neanderthal, Cro-Magnon, Peking man, is that tribal, male-dominant dumb? What's it like being a supermom? Because you're a woman dentist who owns her own business, and you're married, and you got 3 kids.
Yeah.
I mean, and I can't talk about that because I have a baby maker, you know.
But thanks for asking, because I'm
Seriously?
sure you have a lot of women viewers. It's not easy. You know, we're the nurturer in a family, but behind a strong woman, there's a strong man. And I have to say, a lot of how I'm able to do what I want to do is my husband is very supportive of that. My kids are very understanding about it.
Are your kids all boys?
Yeah.
Do you think that makes it easier to be a woman dentist if all your kids are boys, or not really?
Not really. They don't like to do dishes. We're getting there. We're training them to be there. But I think it's core values. You know, like if you set the expectation on the stage, like I can't do this all by myself, your family has to chime in. They'll learn to help you. And then just to be able to be appreciative of that, to, you know, show them that you're thankful for doing that. We're very faith-based family. So when we go through hard times, we're going through it together. When we have good times, we're going through it together. But I think having a vision, a focus of where you want to be. So I've done a lot in dentistry already, so that's why I want to educate more and speak more, because I feel like I had a great time doing dentistry, you know. I love my patients. I don't want to give that up, but yet I want to help more people in a different way. So if it's in my profession, I think that's great, but keeping my family unit together is also part of like that communication. Like when we don't agree with something, we have to talk about it, you know. We have to sit down and talk about it. And my boys know, men, right? They like to go to their cave. They don't necessarily want to talk it with women. I need to talk to you now. This is what's bothering me now. So.
And you believe that's true? You don't believe that's sexist? You believe that's true?
I think it's a balance. Finding the balance.
But do you think, I mean, there is some data. I mean, 80% of people on YouTube are boys.
Yes.
80% of Tumblers are girls. I mean, you do believe that women want to talk about it more, and men want to go in their back cave and shut the door.
So then, as a woman, I connect with other women who are business owners or who are dentists, so that I have a place to vent, get my fill, feel supportive, right? Because maybe my husband isn't, or my kids, they don't want to listen to me vent a little bit. But having that knit group, I think that's where study clubs come into play. Having other female dentists that you network with, like your meeting is a great venue for that, your Dental Town meeting, annual meeting, volunteer activities, those types of things, but also the online forum that you have. So when people comment, we're all helping each other. All of that.
I have Dental Town.
Yeah.
You should start Woman Dental Town. I'm not
Really?
even kidding you.
Okay.
I'm not even kidding you.
You know,
I would take all of Dental Town, cut and paste it, call it Woman Dental Town, and give it to you.
Okay.
But I want to ask you a bigger question.
Sure.
Because this is what they're struggling with at AT still. She's sitting here saying, I got all these mixed emotions. I'm going to graduate from AT Still Midwestern. I'm going to be a dentist, and I'm going to have a practice just like you in Scottsdale. She's got that dream. But then her biology's saying, yeah, but I want to marry some stupid Neanderthal and drop a couple frogs. What's more important as far as here's the exact question. Is it easier to marry a Neanderthal caveman, drop 2 kids, and just work for like Heartland, so I don't have to worry about any of the business? I just go in there and do my Monday through Friday, 8 to 5 at Cigna, Heartland, any DSO? Or would marrying a caveman and dropping 2 frogs be easier and a better idea if I own my own business? Because if she owns, because that's what keeps her up at night.
Right.
What's the better strategy?
I think it depends on the personality of that woman dentist. Because I have a lot of friends who, they're driven, they're ambitious like me, and we all own our own practice. And we manage. We take vacations with our family, we do our CE, you know, sometimes we bring our families to our CE. But then there's that other side of my friends who, they don't want the business side of it, and they'll work for somebody else, leave it at the door, and they're fine with that, or work only 2 days a week, 3 days a week. I think it depends on the personality of that woman dentist, because there's room for two types of women dentists. But if you are in the wrong one, that's where I feel like women are struggling. They're taking Lexapro or what, different types of anxiety.
And it's crazy to say that all women would want the same thing.
Yeah, they don't.
I get offended when people say that all Irish are alcoholics. I'm 100% Irish. Only 38% of Irish are alcoholics.
Right.
You know, so the majority.
Why are you not
it's very racist to say that we're all alcoholics when it's only 38%.
Yeah.
So you, but give her a litmus test. She's listening to you on the way home. How does she know at 22 whether she's cut out for owning my own business or leave that, or what questions could she be hearing right now from you?
Well, how much free time do you want? How much do you want to earn? What's your typical work schedule look like? How much do you want to invest in continuing education to boost your knowledge? Those types of things. Because those are all investments. Those are all time-dependent things. So,
what if she?
But you know what? And I failed a couple things. So then I realized, I don't want to go down that route, or I don't want to do this. So sometimes we have to find out the hard way, right? The way that you succeed is you have to fail a little bit to figure out, that didn't work for me, then I'm going to try something else. But I think having good mentors, like me talking to you, or talking with people who are in the same profession who have succeeded at it, have failed at certain things, they'll share their experiences with you. Having a mentor or coach to kind of help you think out your thoughts is really helpful.
And what if she wanted to just contact you?
Oh, any women dentist can contact me at my email. Are you
going to give it out now?
Yeah, I'll give it out now. My email is bonitadental@gmail.com. And if there are
And what is Bonita?
Well, it means pretty in Spanish.
Does it?
Yeah.
So it's bonitadental@gmail.com. And what about your website?
Our website is bonitadental.com.
But that's your dental practice?
Yes.
But if she wanted to contact you about personal stuff,
right,
or having you lecture at their
momentumdentistry.com.
Momentumdentistry.com?
Yep.
And you got a contact there?
Yes. You could email me through that website.
So that's a Spanish name. Do you speak much Spanish?
I understand it really well. I understand a lot of languages.
Same here. I'm across the street from the Guadalupe Indian Reservation.
Oh, okay.
There's 25,000 Spanish-speaking people live there with no dentist. And I don't speak a word of Spanish, but I do know over the years. I can understand. Like I know my name in Spanish. I know what Howard is in Spanish.
What is it?
They always say Gordo Cracker. So I know that's... Did I get it right?
Not quite, but we'll go with that.
Hey, seriously, it was a huge honor for you to come over.
It was great.
Your teenage boys are gorgeous and adorable and so well behaved. And thank you so much for writing an article in Dental Town. I really hope you contact Howard Goldstein and build this online course.
Okay.
Because everything that you're a master in didn't even exist 10 years ago. And I've been doing it 30. So congratulations on being a pioneer.
Thank you.
All right.